I'm Kevin Ranke, and I'd like to welcome you to Beyond the Echo. I ran for governor in Michigan. After losing that election, my desire to look at issues that are important to the state or the country grew. There is so much static. There are so many opinions. Our news stations have gotten to the point where we don't know what news is anymore. Where do you go to get real facts? This is about real perspective for you. Beyond the Echo will cut through all the smoke, all the opinions. It's not about Republicans. It's not about Democrats. It's about the issues and what are real. Hey, everybody. Welcome to another episode of Beyond the Echo. I am really excited today. I have Rob Burgess with me, and Rob is on a national bus tour, and his bus tour is focused on Big Pharma and how Big Pharma influences our economy, how it influences our health, some of the good things about Big Pharma, but candidly, some of the bad things about Big Pharma. So, Rob, welcome to Beyond the Echo. I'm excited to have you here. Thank you.
Thanks for having me, Kevin. I'm excited to be here too.
Yeah. Where have you been so far across the country in your quest to educate America about Big Pharma?
Sure. Michigan's our fifth state. We started in Arizona back in the middle of August, and then we've been to Nevada and Montana and Wisconsin, and now we find ourselves here in Michigan, and we're so glad to be here. So,
Well, it's good to have you here. It's interesting. I don't know about the other states, but I know that traditionally Michigan has been known for having great health care because of the auto industries. And with great health care comes a increase in pharmaceutical consumption,
mhm.
both good and bad. Michigan's got the distinction of being, I think, the largest per person marijuana producer, a now controlled pharmaceutical in the country since it legalized pot. But Michigan's also one of the biggest consumer of prescription drugs per person.
It is.
And what's that doing to America?
Well, quite frankly, the more and more that Big Pharma has seen their profits grow, really, probably over the last 20 years, we've seen this habit of doctors prescribing more and more medications, right? 72% of Michiganders,
Oops.
a little closer.
To your mouth.
Got it.
Just start right where you're at.
72% of Michiganders tell us that they take a prescription drug on a daily basis, right? However, the largest percent, over 50% of those people, find themselves in the lowest income bracket. And so we are now in this position where, because Big Pharma is pushing pharmaceutical drugs so heavily on the American people, specifically the Michigan population, we're now finding ourselves in a position where these people are having to make tough decisions. Do they get their prescription drug, their life-saving drug potentially, or do they pay the electric bill? And that's what we're really trying to fight.
Well, it starts for me with, does Big Pharma actually have the health of the people that consume their products in mind?
I would say no. In fact, that's the pledge we're asking every elected official to sign is the health over wealth pledge. Ultimately, Big Pharma has continuously proven to the American people they're more about profits over patients.
Well, so that's an interesting point because I want to get to the choices. I want to get to the cost of what the consumer has to experience. But first, let's talk about, if we could. So Big Pharma makes a drug.
Mhm.
Is that their thought? Does someone in government direct them? How do they come about the concept for creating these medicines?
So it's a little bit of both, right? Sometimes there is a need. Let's think of the COVID-19 pandemic.
Okay.
There's a governmental need for an emergency medication, and they fund that R&D, right?
Okay.
And then there's also specific R&D departments at the big pharmaceutical companies that are tackling specific problems that are just out in the wild. And they are trying to develop the cure, or at least the tool that can inhibit whatever that disease might be.
Well, I find it interesting because Americans have more access to medicine.
Mhm.
And when I say medicine, I am talking about drugs because it's more than just a physical act by a doctor. But I think we have more access to doctors as well. But I'm talking about medications than any other country in the world, correct?
I would agree with that statement, but we do not have the best pricing when it comes to those
But
drugs.
pricing is an issue,
Yeah.
but what I want to point out is we have a huge government agency that's supposed to make sure that it's safe for the citizens to take. And yet, we have all these medications, and Americans experience higher rates of cancer, higher rates of autism, higher rates of heart failure, higher rates of blah, 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 diabetes than anywhere else in the world. And yet, this huge government agency, what's it called, Rob?
It's the FDA.
Oh, the FDA, the Food and Drug Administration, another government agency that's here to help us
Right.
get sick.
What is it that Ronald Reagan used to say? I'm from the government and I'm here to help. Those
Yeah.
are the 8 scariest words that we should ever hear.
Eight or 10. Yeah,
Yeah.
I'm here to help you. I said that funny with another guest, and the FDA continues to approve drugs that are cutting edge. To your point, in America, I spent a month in Africa this summer,
Oh, wow.
and I bring it up. What an experience! I'm not going to name the country, but it contiguous to South Africa, and over 60% of the children in the country are HIV positive. Okay, and they receive free medicine to treat their HIV symptoms
Mhm.
and to extend their livelihoods, right? And they're very effective medicine, by the way. The treatments that they get for free in America cost $2,500 a treatment
Oh, yeah.
because Americans can afford to fund the rest of the world in the eyes of Big Pharma.
You're exactly right. And it starts with the FDA, right? That's one of the things that we are
Yes.
concerned about over here at Americans for Pharma Reform is this revolving door between Big Pharma and the government bureaucracy, right? What a lot of people don't realize is that in the FDA, there's sub-agencies, right? There's an agency that oversees drugs. There's an agency that oversees tobacco. There's an agency that oversees, the food quality in the country. The heads of those sub-agencies are not confirmed by the U.S. Senate. They're political appointees.
So they can be a friend of the president with zero experience and get a sweet pension, a candy job,
And direct
in a really nice leather chair in Washington, D.C.
and not only all those great things, but then also direct the funding for what drugs get approved, what drugs go to trial, what drugs are allowed to be on the market, right? They're controlling that aspect. And then they'll leave government service and go right back to Big Pharma.
I hate to say it because we need bureaucrats.
But we need accountable bureaucrats.
Thank you. That's where I was going. And bureaucrats shouldn't be Republican or Democrat in nature. They shouldn't be liberal or conservative in the application of their job. They should be people that understand that their role is about right and wrong and really have the Constitution that pushes away financial influence. And anyone think there's a little bit of bribery going on in the FDA?
Well, I can't make that claim, obviously, on a
I'll make the claim.
podcast.
I think there's a bunch of crooks in the FDA, and it is completely unwarranted, my claim. But it looks like a pig, it smells like a pig, and the results on the American society make it taste like a pig to me.
Well, and Kevin, you bring up a great point, too, about how Big Pharma looks at Americans as being able to fund the rest of the world, right? Here's a stat for your listeners. We pay 2 to 6 times more than the rest of the developed nations on Earth for the same prescription drugs.
2 to 6 times.
2 to
Is
6
that all?
times. That's it. But keep in mind, in some of those cases, that's a 5,000% markup.
Well, I'm saying it facetiously.
Yeah.
2 to 6 times is ridiculous. I understand America has a responsibility for the world.
Mhm.
It really does. It has a very unique position in the world. But I want to be perfectly clear that America needs to put Americans first, not always the suppliers of everybody to the rest of the world. We need to take care of our own house. And like you say, a 5,000% markup times six, that means you pay 30,000 times what another country pays for the exact same treatment.
It's ridiculous. And I know that you've been a huge advocate on this for a long time, going back to your statewide campaign. But at the end of the day, that's all we're encouraging is the fact that we want these pharmaceutical companies that have allowed the American free market to help them thrive and the American consumer to help them get where they are. Let's prioritize the American consumer, right? Let's make sure that the American consumer is not the only industry where you're making your profit.
See, when it comes to medicine, I don't know that anybody goes to the doctor and says, I want 10 prescriptions.
Oh,
You know,
I think we are dealing with that though.
Well, they go to the doctor looking for solutions. And the doctors are paid by Big Pharma to provide a medication that may or may not treat that solution. And there's all sorts of efficacy and there's all sorts of cause and effect that go into this. But I want to be clear because government does need to regulate some industries.
Sure.
And the immunity that Big Pharma receives on many different levels because of all those layers and being so intertwined with our government, I think is wrong because it diminishes accountability.
It diminishes accountability, but also we have to look at it at how are they manipulating the levers of government to continue to grow their profit.
Yeah.
Right. And so one of the things that I think about when we're talking about this very issue is we're one of the few nations in the world that allow to direct to consumer advertising for pharmaceutical drugs. And so to your point, we as patients should be going to our doctors looking for solutions. We should be able to have that conversation with our doctor. This is what I'm feeling. This is what is happening to me. What's the best course of treatment for me? But because we're getting television ads pointed our way and we see this fairy tale, oh, I wanted to open a juice bar, but I had this skin rash and it prevented me from chasing my American dream. But I took insert drug name here and my skin rash went away. And now I have a thriving juice bar business. You know, go to your doctor and ask for this.
You know what? Gag me. And I get it. That's advertising, but gag me because guess what? You just talked about a very expensive way of marketing.
Yeah.
And there's a difference between need
and desire.
You know, we can go into a lot of drugs that deal with desire.
You're right.
Some of the fastest growing, most profitable drugs in our country are based on desire.
You're 100% correct. But these pharmaceutical companies are spending more money on television ads than they are on R&D.
Yeah.
Right. And they're no longer having conversations directly with medical professionals. They're having conversations with a consumer who has no medical training, who does not know what's exactly wrong with them.
Paint a picture.
Paint the picture. Exactly right. And so that's what we're trying to do. We do believe government has a role here. You know, and I will tell you, my entire career, I have been probably one of the loudest voices for saying we need smaller government. But in this situation,
you and I are shouting together.
Oh, I bet. I bet. But in this situation, I think it's very true that government has a role to put guardrails up. We're asking Congress to stop the practice of direct-to-consumer advertising. We want them to start approving the heads of the FDA.
What happens? And let's break this down because I don't know. I'm being honest with you, Rob. I don't know if government should appoint the head of the FDA. I'm open to that discussion. As a rule, because I think of smaller government and less government intervention, and maybe because there is a degree of distrust based on the results government has gotten us previously, I get nervous about that. But what happens to the price of drugs if you eliminate direct-to-consumer advertising? How much could that or should that reduce the price of prescription medication?
So our estimates is that if you ban direct to consumer advertising, you're probably looking close to $1 billion per big pharma company that's being spent a year. That's going to, that's an average, right? Some are spending more than that in direct to consumer advertising. Some are spending much less.
How does that impact the price of a prescription drug? Is it 15%?
I would
20%?
say we're probably looking 20 to 30%.
So 20 to 30% if we eliminate advertising direct to consumer. Now, there's a practice that Big Pharma likes to use. They introduce a drug, and those drugs are patented. So they're protected when they come onto the market. And our government enforces the laws protecting them. And generic drugs traditionally are introduced when a patent expires.
Correct.
But we've got Big Pharma that's gotten smart, and they say we really like those, private markets, those really, really, financially lucrative markets. Thank you. I was having a brain fart. And so what they do is they alter the patent to keep their drug unique. So instead of a traditional patent period, which is 7 years?
It depends. It could be anywhere from 7 to 17. So.
7 to 7. I didn't realize that it could go to 17 years. So from 7 to 17 years, and what they do is they alter the drug just enough to get a new patent.
Yeah.
And that continues to protect that market, continues to protect their profitability, and it allows them to dominate within those segments, thus reducing competition. And are generic drugs as good as original drugs?
100%. It's the same chemical formula.
Oh, it's 100%.
100%.
And how much traditionally do generic drugs cost? Less than?
I've seen it as much as 95% less.
95% of a discount. I happen to take a statin, and I happen to take another drug daily. And interesting to me that I take the generic. I take the generic. For the rest of my life, I got to take this drug. It's oh God, why am I forgetting? It's a thyroid drug.
Okay.
The name of it. And in the Great Lakes state of Michigan, interestingly enough, like 75% of the thyroid medication in the world is given to people that live in the Great Lake watershed.
Got it.
And that's a whole different story. But my thyroid doesn't function. So for the rest of my life, I've got to take this drug. I take the generic. And I got to tell you, I get it for free. I get the drug for free. My insurance plan actually works in that particular instance. The other drug that I take is a protected drug. And that costs me several $100s a year to take.
And in some of
and
these,
by the way, there's a generic that's out there that could be that is being restricted because of those patents or those minor tweaks.
You're exactly right. And that's what this pharmaceutical companies do. They find the most profitable drugs. Like you said, it's called evergreening the patent, right? And they will make an insignificant tweak to the formula. It changes nothing with the makeup of the medicine, doesn't change how the medicine works at all. And they get another couple years of protection, and it keeps that free market from competing. But what's scary is that you're paying for a on-brand drug that's costing you a couple $100s a year. There's drugs on the market right now that people are paying thousands of dollars a month for that generics can't compete with because of this evergreen patent process.
So technically, well, let me ask this question first. Prescription medication constitutes what percentage of our overall healthcare costs?
I don't have that exact number, but I can tell you that prescriptions have been written at a higher rate over the course of the last 10 years than they had in the 20 years previous.
I'm going to make this suggestion, and I'm going to ask you to get back with me.
Sure.
To look this up. I'd like to know, and this is purely for example purposes, if healthcare in America costs 100, does prescription medication cost 10, 20, 30, 40, 50, 60, 70% of that 100?
I'll find that number for you, Kevin.
You know, I think that people need to know, because I don't know about you. Oops, there go the glasses. I don't know about you, but self-employed.
Yeah.
So
Self-employed.
I have a $20,000 deductible on my Obamacare plan to cover myself and my family. Very, very expensive.
Mhm.
And I don't like that. But if I could cut my healthcare costs 10%, 20%, 30%, 40% simply by utilizing generic drugs in shortening the terms or the protections that Big Pharma receives. Here's another question I have. Big Pharma loses a patent. How often does Big Pharma, that created the drug, then come out and create the generic for the same drug?
So it
And
happens. I
bring it
would
to the
say it
market.
doesn't happen nearly as often. That's where the free market does work, is there's plenty of generic manufacturers out there that are they're fighting tooth and nail to compete. But every once in a while, pharma will create an off-brand of their own drug. And that's something that we could also look into. The thing that's probably more concerning is how the side effects of their name brand drugs ultimately end up becoming the use of the drug. Right, Ozempic is a perfect example.
Yeah.
Ozempic was originally designed as a diabetes medication.
And does it work?
And that had a side effect of weight loss.
Yep.
Didn't really work that well as a diabetes medication, but they said, man, everybody's losing weight on this. Let's remarket it as a weight loss drug.
Well, see, so I want to be clear on that. And I asked, does it work for diabetes? I've read studies that you can question
Right.
the efficacy
I've
of
read those same
Ozempic.
stories too. Yeah.
But I got a bunch of friends that are stabbing themselves, losing weight like crazy. I'm busting my butt in a gym.
Right. You and me both. And it's not working.
And yeah, it doesn't work. And I'd be lying if I didn't say, I'd like to knock off 20 pounds. Boy, wouldn't that be easy? Stab myself.
Right.
Only in America.
Only in America.
And Ozempic will do that.
Mm-hmm.
And it's turned into
there's a couple others, but yeah.
It's turned into a multi-billion-dollar profit
But
opportunity.
ED drugs are the same way. You know, Viagra.
Did you say ED or AD?
ED.
Oh, ED.
You know, Viagra
Schwang drugs?
it was an accidental discovery.
Got it.
Right? You know, that was not the intended purpose of that drug originally.
What was Viagra designed to do?
that-
I've got a limited focus when I hear
I know you
Viagra. It only does one thing.
That was my mistake. I should have known that, Kevin. I
well,
apologize.
I got to tell you, I don't know if it does it well or not. I'm glad to say at 63, I don't rely on that. But
so I've got to go back. But my understanding that it was a blood pressure or heart medication. It was something to deal with circulatory, and they realized that it had this side effect, and once again, it became the focus of the drug. Right?
And if your side effects last longer than 4 hours, you should be proud. Go to a medical provider, but be proud.
But, you know,
unnatural to say the least.
I think that, and I'm so glad that you've got this platform to share with your viewers and your listeners, but it's part of the reason why we're on this 6-state tour, right? Is that Americans are really paying attention right now. We are probably in one of the most consequential moments in our country's history. We've got a historic election, and this is an issue that's going to touch every American life, regardless of age. The stat that I've been using a lot here in Michigan is 72% of Michiganders believe that Big Pharma needs to be reformed. But when you break that down by age, the two groups that are dead equal out of that 72% that believe it are the youngest group, 18 to 25, and the oldest group, 62 plus. Both equally agree that Big Pharma needs to be reformed. So this spans generations.
That's interesting because I have 3 kids.
Mm-hmm.
I have a 31-year-old daughter, 26-year-old son, and a 21-year-old daughter. And interestingly enough, my 2 youngest, who are not in the medical field, my oldest is a physical therapist. They look to pharmaceuticals or supplements to provide
Mhm.
many of the things that should be accessed through vegetables, for instance. Can you take a pill that gives me the vitamins from vegetables?
I really don't want to have a glass of orange juice today. Can I take a pill? Right.
Exactly. Um, can I take a pill that does this or does that? And because it's easy, it's fast, and when it's marketed as inexpensive, um, talk to me for a minute because I think Big Pharma also plays in the fields of like a GNC,
Sure.
nutrients, and wildly, wildly profitable and completely unregulated, or predominantly unregulated for their claims to, be it adding testosterone to your body, adding proteins and muscle mass with very, very, very little.
Well, a lot of what you see is not approved by the FDA, and they have to put that label right there, not approved by the FDA.
Yeah, that
You
you
know,
can't
consume at
confirm
your
the
risk,
right.
right? No true measurements have been taken, right? And so some are playing in that space. But what a lot of people don't realize about Big Pharma is that Big Pharma is very quickly also becoming farms. They're getting into the agricultural space, right? And they're starting to now also.
Genetically
There
modified
you go.
foods,
There you go.
which are terrible for us.
Right.
That's crazy. I did not
Yeah.
realize that. I had a cousin, God rest him, he died of multiple sclerosis.
Oh wow.
And part of John's food um, repertoire, they recommended a significant increase in the amount of fruits and vegetables.
Mhm.
And so his mother would go out and buy fresh fruits, fresh vegetables, and serve them to him. And as John continued to degrade, he finally came across a doctor, and the doctor said, John, it's great that you're consuming all these fresh vegetables and fruits. When you buy them from the store, what I want you to do is put them into the sink,
Wash
plug
everything
the
off.
sink, fill it with cold water, and take a half a cup of hydrogen peroxide and pour it into the water and let it sit in there for 10 minutes. And I thought, God, that's weird. We used hydrogen peroxide. I always liked it because it fizzed up on
Right.
your cuts and stuff. But so I go shopping for myself and I buy these veggies and I put them in the sink and I fill it up with cold water and I put in a cup of hydrogen peroxide and I let them sit for 15 minutes. Folks, it would gag you. The scum line in my sink from the hydrogen peroxide releasing the waxes, the chemicals, the pollutants. You're thinking that your fruits and vegetables are clean, the bugs. It's crazy. And I would encourage people to try that because all those processes are part of what I believe are making us sick. A lot of kids think, oh my God, my lettuce is washed at the grocery store,
Right.
so I don't need to wash it.
No, you got to rinse everything.
You got to
Yeah.
clean it.
That's right.
And I bet you, there's a lot of folks out there that don't do it. Any vegetable, any fruit needs to be clean. You take your apples
Run them. The cherries.
that
We're
you
in-
don't, well,
We're in
even when
Michigan.
cherries here in Michigan,
Yeah.
when you pick them off a tree, you think, hey, this is fresh. Well, guess what? There's pesticides and sprays
Mhm.
that they're using on those trees
Mhm.
and on those fruits to protect them. And when you put them in that solution, and there's other solutions out there. Recently, I saw an ad for a product that just came out that was professing to do the same thing. And I thought, oh, it's expensive hydrogen peroxide to, take the chemicals off the fruits. What's the solution, Rob?
So the first thing is education, right? For too long, we have not allowed common sense into this narrative, We've allowed the big pharmaceutical companies to control the narrative by talking directly to doctors groups and medical groups, by now allowing direct to consumer advertising. So that's why we've gotten involved, and we hope to be in this space for a long time, is to make sure that we can educate people about what's going on and it become an issue that is decided at the ballot box. Two, we need to go ahead and we need to put some guardrails up, right? That's why we're asking for those three things. America first priority when it comes to consumer pricing on prescription drugs. Stop having us make 2 to 6 times more than the rest of the developed nations. Two, let's go ahead and stop the revolving door between big pharma and government. And then three, stop direct to consumer advertising, right? We think those three things are a great first step. Does more need to be done? Absolutely, right? But how do you eat an elephant? One bite at a time.
Sure.
Right? So let's get 3 things done. We'll find 3 more. And then lastly, it's making sure that the people are asking their medical professionals the right question, right? It's perfectly fine to trust your doctor. In fact, we encourage you to find a doctor that you feel comfortable with and you trust, but also ask them the questions. Is this the best medication that I could be taking in this scenario? Or is this the medication that your medical group contracts with that pharmaceutical company? Right?
It's an interesting question.
You know, there could be 3 versions of that drug offered by 3 different companies.
Can a doctor offer a generic right from the get-go?
Sure.
Again, I'm a statistics guy. I like numbers. What percentage of prescription drugs are covered by a generic drug as well?
Oh, that number has to be astronomical. But again, their marketing budgets are so much smaller.
Well, I
Right,
get
yeah.
it. Yeah.
And
no-
so there's not a lot of knowledge about what's going on in that free market, and so that's why we want big pharma to compete, right?
So it's not. This is still free market because I'm a big
Oh,
free market
me too.
guy. But you have to be on a level playing field for
That's right.
free market to be effective.
That's right.
And the regulations and the rules at the federal level, there should be a responsibility.
No, absolutely. You're 1,000% correct. And this is probably why you're so good in business, right? But when you start thinking about how do we approach this free market principle, right? First off, the free market's what allowed these 10 pharmaceutical companies to thrive in the first place. We are not saying that they shouldn't be successful. We're not saying they shouldn't make money. We're simply saying they should not be afraid of competition. If the free market wants them to continue to thrive when they are competing against all these generic manufacturers, they'll thrive.
Yeah.
But if all of a sudden their market share dwindles, if all of a sudden they can't charge the same amount for the same drugs because they have to compete against the generics, and all of our costs and our prices start to fall, then guess what? They created a monopoly and they're getting punished for it.
It's interesting. I think we're seeing a little bit of this in the software industry in a different way. There's products that might be better than Google and Microsoft.
Oh, sure.
And it's really tough for those products to get a footing. There's products from a cellular perspective that may be better than AT&T and Verizon. And it's fascinating how all these companies intertwine.
And they all piggyback off of each other.
That's what I'm saying. They
Oh, yeah.
piggyback on each other
Oh, yeah.
to maintain profits instead of letting Americans do what they do best. And that's that creative juice, that ingenuity that exists here that is so unique to America that really helps stimulate our economy and our republic's success over the last 250 years. It's almost like a monopoly.
You're exactly right. And I'm glad you use that word republic, right?
Yeah.
That's a big thing that we've been educating people about too, as we've crossed the country, is they keep saying, well, in our democracy, I have to run it. You're not in a democracy.
Yeah.
Right?
Democracy means 50 plus 1.
Yes.
And the other 49 have to suffer. And that's not how a republic works.
No.
And, I don't mean to be political. The Republican Party, those that actually are true Republicans within the party, want to strengthen the value of the republic versus diminish it. The Democratic Party likes to talk about a threat to our democracy.
Right.
And there is no threat to our democracy because we are not a democracy.
We aren't in a democracy.
They're trying to push us into a democracy which totally changes how America would function. And by the way, a democracy would allow for Big Pharma to be stronger,
much stronger,
because the influence of that major player
is so greater.
Absolutely.
If we were in a democracy, every decision would be made in New York and LA. I mean,
anybody out there uncomfortable with that? Let's see. I want Gavin Newsom making my decisions, right. Or what's the wacky lady from
Hochul?
Hochul
In New York.
Her statements were crazy the other day that she was making about immigration and about even hurricane relief.
Yeah.
Wow.
But there's a lot that can be done.
Sorry about that. I digress.
There's a lot that can be done, right? And it all starts with education. And that's why we're on this bus tour. And I hope people will take a few minutes and they'll go to our website, americansforpharmareform.com, and learn a little bit more about our organization.
Are you well-funded?
So we are always looking for more funds, right? We are a nonprofit. We're a 501c4. And so we're education-based, right? We try not to get involved in the partisan side of things. We believe that every issue has a right and a wrong side, and we're simply trying to educate people about what that side is. So we're always looking for more people to join our cause. But yes, we're very well funded right now, and we have a mission to get us through probably in the next, I'd say 8 to 12 months. And we're hoping that we can be part of this conversation for 8 to 12 years. So
well, I think it's really, really important that access to drugs is a benefit that American citizens have.
Mm-hmm.
Access to drugs at a fair price should be a benefit that Americans have, because consumption in America, because of our financial position at every level, by the way, allows that access to the drug. And we need competition. We need to continue to have the creative juices in our medical fields, create that competition for better results and better medications. We are seeing now more than ever before, I believe, the consequences of medications having side effects, not only age-related side effects due to long-term exposure, but generational side effects. Kids are being born with lowered immunities and resistance because of their parents' medical consumptions. It appears to me. So it's a fascinating area. It's something that needs to be continued to look at. It's got to be a hell of a lot of fun and very, very interesting to go from place to place to place on this bus tour. And I'm looking forward to learning more and seeing more from your group. And I think that every American needs to look at it. And I love the question, if you would repeat again, is this the best medication for my condition?
Or is it simply the one that you're contracted with?
Is this the medication that you and your group are contracted with to prescribe?
Right.
It's gone over my head till today. Great question.
Thanks for having me, Kevin. And you've said this in the past, and it's sort of something that I've carried with me, and we're really utilizing on this bus tour. But it's the American dream has not died a single time throughout any generation, right? And when we are looking at pharmaceuticals, the pharmaceutical that you're taking is not going to be the thing that helps you achieve your American dream. What's going to help you achieve your American dream is standing up, participating, taking a look at what's happening around you and saying, I'm going to make a concerted effort to change it.
Yeah, government isn't the solution. Government is the problem.
That's right.
Most times. But in this case,
it could help us.
In this case, you bring up a really good argument and nuanced that maybe government should be more involved.
A little bit.
Well, you know what? I'm willing to consider that, and we'll talk more.
Thanks, Kevin.
Thanks, Rob, very much. Appreciate you being here today.
Pleasure.
Yep, Rob Burgess on Big Pharma, the impacts on you on Beyond the Echo. Thanks. Thanks for tuning in to Beyond the Echo. If you enjoyed today's episode, be sure to like, follow, and subscribe so you never miss an update. We'd love to hear your thoughts, so drop us a comment and share the podcast with your friends. Stay connected and keep the conversation going by following us on social media. Until next time, keep exploring beyond the echo.